The Ivari tutorial app for WFG agents and associates. Part 4. The attending physician statement APS guideline. Now notice they refer to these documents as guidelines. Actual policies may be due to the office that you are actually working under, if you are not running the office yourself. What is an APS? The attending physician statement APS is a report generated by an attending physician documenting a proposed insured's medical history. The report can take the form of a narrative summary, actual physician notes, or copies of hospital, laboratory, or testing results. Ivari uses DynaCare KeyFacts as third-party source to facilitate acquisition of this data. What to expect in APS? When to expect an APS? A completed APS is often the most helpful document for an underwriter to have in order to make the best offer to your client to avoid a decline. An APS may be required when there has been medical consultation prior to the application written date on, other than for a cold, flu, normal prenatal, or a routine checkup. There has been any visit to the emergency room in the last year unless diagnosis made and benign. Expect an APS if your client has one of the following conditions. The chart below provides a minimal list, and the medical condition could result in a request for an APS. Ivari reserves the right to request an APS at any time, including life and critical illness insurance, abnormal PAP PSA within 1 year, any routine diagnostic testing within 1 year with pending test, echo, scan, biopsy, etc. Brain disorders, cancers or tumors unless BCC, mole, polyp, or growth, child less than 2 months old and born prematurely. Cardiac problems, congenital heart disease, stroke, arrhythmias, heart murmur. If you ask me, 9 months is way overline. Heart murmur and other functional. Diabetes, non-controlled or non-compliant with treatment. Expect an APS when treated with insulin. Endocrine disorders, except stable hyperthyroidism or other well-controlled benign condition. Glomerulonephritis or kidney disorders other than kidney stones. Lymph node disorder, multiple sclerosis, muscular dystrophy, musculoskeletal disorders with any limitation of treatment other than NSAID, oxycodone, MS-Cotton, or antidiuretic. If you ask me, don't touch this stuff. Pancreatic disorders, Parkinson's disease, past suicide attempts, psychiatric illness, depression, anxiety, depending on severity, recent syncope, respiratory disorder, and COPD with a regular follow-up is required. Rheumatoid arthritis, depending on severity, seizures, epilepsy, ulcerative colitis, or Crohn's disease. BMI over 35 requires minimum measurement values done by a paramedical or a tele with vitals except an APS when mortality rating is 200% or greater. Expect an APS where there are cumulative risks, example HTN plus lipids plus build plus smoking. Expect an APS with a senior client. The end.